Hello, everyone. Thank you very much for making it to today's program. My name is Pharmacist Esther Eduru, and today I'll be speaking on lifestyle modification in management of diabetes. Now, in management of diabetes, it's very important that we pay key attention to lifestyle modification because the aim of every diabetic patient or people living with diabetes is to minimize long-term complications by lowering their glycemic index. And now, what are some of the lifestyle modifications that it's very important that diabetic patients put to practice? First, weight loss and exercise. A balanced diet rich in whole grains and legumes will go a long way in controlling weight, at the same time an active lifestyle. It is also very important to use medications according to the doctor's prescription. Yes, proper use of medication and lifestyle modification go hand in hand. One should not say because I am taking my medications, it's an automatic um, disregard for lifestyle modification. No, they work hand in hand, and it's important that patients keep to recommended doses and take these medications at the right time. Endeavor not to skip a medication dose. So, in order to be able to remember not to skip a medication, please set a timer. It's advised to have a timer handy and keep a logbook to be able to enter at the time in which you had your medication and the time for the next dose. This will go a long way in encouraging compliance. Also, eye care is very important. Diabetic patients are prone to eye complications, that's retinopathy, that's the disease of the retina. So it's important that routine medical checkup to a doctor, it's advised to see an optician to be able to know the state of the eyes. I would also want to talk about the importance of drinking lots of water. Water cannot be overemphasized. As much as possible, please stay hydrated and also avoid alcohol or minimize your alcohol intake. Routine medical checkup is also very important because a lot of diabetic patients are prone to end organ damage affecting the kidney or the liver. So having a routine medical checkup to have a full body overview to be able to know the state of health and how the organs in the body are performing will go a long way in helping diabetes patients manage their diabetes at the same time reducing complications. Let's not forget the importance of sleep. Rest is essential. In our everyday life, the hustle and bustle of the day's activity can get overwhelming that we forget to take rest. So please endeavor to take rest, endeavor to sleep. Also, avoid smoking. It's important that diabetic patients should avoid smoking and also avoid secondhand smoking. Now, what is secondhand smoking? A person can say, oh, I am not smoking, but it's present when other people are smoking, at the same time inhaling that smoke that is being exhaled while smokers are smoking around him. That's secondhand smoking. That's secondary smoking, and that's really not advised for persons. Even if one is not managing diabetes, secondary smoking, secondhand smoking, it's not ideal for the body. It's also important to have a glucometer handy in the house or around you or in your office. This will help in being able to track one's fasting blood glucose levels, random blood glucose levels. It will go a long way in helping an individual know the need for a meal plan. What was the meal I had, and when I have this meal, how is my glycemic control over a period of time? It will go a long way in helping to keep an active lifestyle and help an individual to know if he's all doing a good job at managing blood glucose level. Having a glucometer as well will also help an individual to be able to be compliant so that at the end of about 2 to 3 months, the HbA1c values can be significantly controlled and within range and be a good value, because these HbA1c values will be able to tell an individual how compliant he has been in managing glucose levels over a period of 2 to 3 months. Now, it's very important that we note that diabetic patients are prone to peripheral neuropathy. Sometimes they do not feel sensations in their foot. That's if they did not manage their diabetes very well. So foot care is essential. Try as much as possible to wear comfortable shoes, no tight socks, routine checkup on the visit a doctor to examine your foot in order to avoid charcot foot. And this happens when sensations, the bones are weak or on the ankles, and an individual is not able to feel such sensations due to these weakened bones and blood vessels. In the severe cases, a foot that has gotten so bad and has experienced peripheral neuropathy, and you could see a person being exposed to hot water burning the leg and the person doesn't know, or the person keeps his leg on a hot surface and the person doesn't know, and these are some of the complications of diabetes. Now, this is not to scare us here in this audience. Diabetes can be managed, it can be controlled. A lot of persons are living with diabetes and they are happy and healthy. It all depends on the individual. Is one willing to take on this lifestyle modification to see a good result? The answer lies on the individual. But as I always say, as I always tell my patients, diabetes is not a death sentence. Together, we can control diabetes and its complications. We can be able to live happy, healthy lives. My book, Eat Right, Live Right, A Guide on Managing Diabetes Through Lifestyle Modifications and Healthy Living, it also contains 50 healthy recipes. It discusses in depth on these lifestyle modifications that should be imbibed by diabetic patients, and also healthy meals that are readily available in our environment that could help one enjoy their meals and say no to boring foods. Thank you so much for your time. Until we meet again, I am Pharmacist Esther Etopediok Edu. Bye. Oh, thank you so much for making it to today's event. I am so excited to have you all here. Thank you for your time. I appreciate it. Until next time, I am Pharmacist Esther Edu. Please feel free to ask any of your questions in the comment section and we'll give you a response, or you could send out your questions through the email link that was sent to you. Thank you so much. Bye.